And we know University Medical Center is expected to start distributing those vaccines as early as Monday.
So let's bring in our medical expert, Dr. Samir Islam, and talk more about how this is going to work. Doc, it's good to see you. Take us through the distribution process once the vaccines arrive at our hospitals.
So this is actually really good news. I'm so excited to tell you guys about this. So what's going to happen is that those healthcare workers who are on the front lines who chose to get the vaccine will actually just set up an appointment, and at that appointment time they'll get their first shot of the vaccine. Then roughly 3 weeks later they'll get their second shot.
Okay, so you mentioned the second shot. So why are there two shots for this?
So the first shot is to get you the initial immune response. So you can actually produce those antibodies to attack COVID-19. So that initial shot, you may get symptoms like muscle pains, some small fevers. That is your immune system developing those antibodies. And then you'll get the second shot as a booster shot, so you can have the full immunity against COVID-19.
Okay, interesting. So they're full immune after the second shot. Will we need boosters for this in a year or two, like we do some things when we're kids?
You know, that's a very good question, and unfortunately, we just do not know the answer to that. And so we're going to know in the next couple of months about whether this vaccine is one and done and that's it, or whether you need to get yearly booster shots like you do for the flu.
And we just talked about a couple of people who were getting sick because they had allergic reactions to this. Is this something that we should worry about here?
So by and large, it does look like the vaccine seems to be very, very safe for a lot of people. Now, there will be a time in which we'll get information from an expert of panels to let us know which patients should get the vaccine and which ones should not. And during that time, you should obviously speak to your healthcare provider to see if you are a person who should not get the COVID vaccine. But we don't know exactly at this point in time which those people will be yet.
On our safety measures as well there. So, okay, first round goes to medical staff, then to at-risk folks. Do we have any more clear picture yet on when the vaccine might be available to the rest of us in the general public?
So we're hoping at the earliest it might be in spring of 2021, which means from then until now, we still have to do the things that we normally have to do to protect ourselves. Wear a mask, social distance, wash your hands, keep yourself safe and keep yourself protected, because hopefully when the vaccine does come to the general public in the spring, we'll have a much greater impact in preventing the spread of COVID-19.
Let's hope, for sure. Okay, after you get the vaccine though, still wear the mask and all that stuff too?
Yes, that's a very good point. So what we do know is that it's going to take several weeks for the vaccine to be fully inside your body to have the full immune response. And so, yes, certainly wear a mask. Now, we'll know in the next couple of months how effective the vaccine is going to be against spreading the virus. And so we'll know if we still have to keep wearing the mask and for how long after we get the vaccine. We don't have the information right now, though.
Well, we do have a vaccine on the way, it looks like, and that is definitely good news, and always good to talk to Dr. Samir Islam. Thank you, sir.
Thank you.
All right, let's give you a look, by the way, at today's virus report from the Lubbock Health Department.